So, key purpose for our clinical network for learning disabilities within the Trust is to engage the clinical workforce around service remodelling, quality improvements, process pathway development, engagement with service users. It's around changing the system of engagement from one of top-down operational management to real lived clinical engagement that provides a basis and a framework for service user co-production and collaborative development of services. So one of the key messages that we've had from the outset with the learning around clinical networks is the idea of the distributed leadership, distributed responsibility. The network is more than each of the individuals that are around the room, but equally everyone has a responsibility to promote the messages within what we're trying to achieve within the clinical network. So any opportunity to engage, not just within our learning disability workforce, but with colleagues in other specialties, give the message around what it is we're trying to achieve and to get people connected into the work programme that we're leading on within the clinical network. It's been remarkable actually. Some of the things that we've tried to achieve over the years is around embedding best practice and quality across all services that we deliver within the organisation. It's one of those intractable problems. Everyone has the same direction of travel, but it's the vehicle that we use to get there. And I think what we found with the clinical networks is it gives us that opportunity to highlight those areas of work that transcend just one area of specialist working. So accessible communication, for example, is one area that has a bearing in all areas of our clinical service delivery. I have to be honest, the tools that are provided through Source for Networks have been absolutely fantastic in enabling learning around clinical network delivery for my colleagues who weren't fortunate enough to join me on the leadership programme, because we do need very clear teaching and models around how networks operate to understand how we step outside of our typical hierarchical structures. So there's a range of benefits and outcomes actually that come from the work of the LD Clinical Network that transcend just our specialist area of working. So there are clear improvements. So the confidential inquiry into premature deaths of people with disabilities, for example, came with a whole series of recommendations where we can improve communications and acknowledgement and identification of vulnerable people within health systems. And by embedding the recommendations of that report, all of our service users benefit from improved access and health quality across the services that we deliver.